Welcome, Tamsin, Chik, to the Total Therapy Training Podcast, a podcast where you accompany me in my journey for traditional Chinese medicine. How are you today, Tam?
Oh, wow, nervous. Talk about the elephant in the room. Like last time we did a podcast, I was 3 hours away from you in my own little bedroom, and now we're sat opposite each other, needles in our head, just to calm us down a little bit. But yeah, I'm excited.
Cool.
Yeah.
I can't wait to hear what you've got to say. So today, Tam, we're talking about Chinese cupping and everything that it entails. I am really excited to hear from you, as you are my therapist and practiced cupping on me many a times.
Yeah.
And you have worked wonders on my body, emotionally and physically. So Tam, please tell the listeners, what is your story and what brings you to the wonderful world of TCM?
Wow. When you gave me the questions, there's many elements to this answer, because obviously Sarah knows my history, but the listeners not so much. So I am of mixed heritage, dad being from Hong Kong. Both parents were from medical backgrounds, nurse and medic. So then when we moved forward, and my mum, I suppose, had learnt lots of different things from being a nurse, and watching them both revert back to natural approaches. So when I was small, I had asthma.
Okay.
They took me to a lady in somewhere in Birmingham, and she gave me a little bottle of brown stuff, and I had to hold it and see my hands. Like, she put pressure on the one side, and if the one side dropped, she'd give me another bottle, or I can't remember exactly which way. It was either if one was resisting, she'd give me another bottle. But anyway, she was a homeopath.
Right.
One session of these horrible brown herbs that she gave me, and no more childhood asthma.
You're joking?
No. And then when I was small, like I'd get a bruise or something like that. I did mention it in my last podcast, but I'd have like a boiled egg rubbed on me to get the dead blood out.
What, with a shower?
Yeah.
Wow.
So all these different things growing up, I had, like, my mum would use garlic to help heal infections. Trying to think, it was just normal.
Yeah.
My dad opening windows when everyone else is like got the heating on, but he's like, right, you need good air, And he takes stuff out in the garden, and he'd be beating it to get the dust out to help the air quality. So I was brought up around these things. So that's the one side of it. I suppose that's where the seeds were planted. And then in my notes, I've written the kid's dad and family house. So fast forward to me being a grown up, and my kid's dad was really, really poorly, and I just felt like out of control, like helpless. I didn't know what to do. So I went to college. I wanted to be a dietitian, but life would not allow for that, because 2 young kids, university, wasn't going to happen. So from there, I ended up doing beauty, family love massage, and at the same time, I was a fitness instructor, but also a meditation teacher. So randomly, Andy Morgan from the Tweener got in touch with the gym and said, do you have anyone who could provide a wellbeing day? So they sent me literally over the road, and I did my little thing. And then me and Andy were chatting for ages outside, and he told me about what he was learning. He was a student at the time, and then introduced me to Michelle. And it was like the universe was just like, there you go. And since about 2016, I've been with Total Therapy. So those seeds are well and truly watered from them. But I suppose TCM, really, I was born into it. Like, going to meet my family in Hong Kong, certain things that they do, as much as they're like up to date, I suppose, like into Western medicine and that, there's still those elements they understood. And I talked about the concept of damp, they get it. And it was refreshing, because they're not trained in that background, but that is still part of the culture very much. So yeah, lots of things really.
It's like when I was speaking to Martina last week about the herbs and stuff, and she said to me, "You were just born in the wrong country," because I'm like, why don't we know about this stuff? So with a boiled egg and stuff like that, because I got to know now, is that an art, like a military thing, or is that a Chinese thing?
My dad, like, he'd say, I don't know exactly why I do it, but my mum used to do it. So he'd have like I think called white flower oil, and it really stunk, but it was like an application, and you can get it from any Chinese supermarket, along with the Chinese spoons can be used for gua sha. So my dad's understanding is literally get the dead blood out.
Yeah.
So when we were at our friends the other day and she's rubbing my leg with the woodlock oil to get the bruising out, everything is in increasing the healing process. It's speeding it up. It's stopping stagnation, which I'm going to talk about later when it comes to the cupping.
Yeah.
To move it along quicker, so things aren't sat and stagnating in the body. So everything's about healing and like helping the body to do it naturally. So the boiled egg was part of gua sha,
right,
to increase the blood flow.
Who knew?
I know, it's mad.
Who knew? But like, so because I just think when you get a bruise, you get a bruise.
Mm-hmm.
So if it doesn't come out properly, quickly, and you don't speed up the healing process, it causes stagnation. And what can that do to you then?
Well, I always think of the body as like a little stream.
Yeah.
If you've got loads of rocks and sticks in there in that stream, then it can get all like congested and horrible and give off gases. So you think of that like a heat. So these are different diagnostics that you're going to come across within the different podcasts. There's lots of elements. So say you bruise a lot, right?
Yeah.
It can be a spleen issue.
Oh my God.
Because things aren't holding together properly. It's like your transportation system, and if that's interrupted, commonly by overthinking and sweet foods, then it's going to slow down the healing process. If you've got bruising within your body, a scar tissue, anything like that it needs to heal. Yeah. But if your body is already deficient, it's not going to be able to speed up that healing process or even heal at all.
So that's just blown my mind there, because remember that treatment you gave me and you were rubbing on my spleen with the gua sha tool and I was in agony.
That was mean of me. It's only because you're my mate.
But before then, I used to bruise really easily. Yeah. And I remember thinking, because this was quite a while ago, I remember thinking, I haven't bruised for a while.
Really?
Yeah.
Really? That's mad, see? Yeah. Yeah. And spleen, obviously, because of the overthinking we do in this country, so spleen can cause issues lower down. So if you've got edema around your ankles, that's your spleen 6 point.
Right.
And sometimes, when you're dealing with like women's gynae health and stuff like that, you're going to look towards spleen because it's holding things together. Prolapse, that is because things aren't being held in place. So these needles we've got in the top of our head at the moment helps pull the energy upwards. So prolapse, piles, that kind of stuff, it can treat that as well. So yeah, it's just the world of TCM. Why am I in it? Because it is just unstoppable and it is just amazing.
Sounds
you
crazy.
Run with it. Yeah. The more and more you learn, if you're finding out, Sarah, you just like, what can it not treat?
Exactly.
Mentally, physically, and it sees the links between it. So yeah, it's amazing.
And I love it because when I did the podcast with Jamie Hedger again a few weeks ago, and he was saying that sometimes you just need to find the right teacher. The treatment could be the same, but the teacher could be the one for you that you resonate with. It's, oh my God, it's fascinating.
Amazing. It's amazing. There was a study actually, I can't remember where it was, but it'd be interesting if we could find the link to it. But it showed, because a lot of the time you'll get people say, acupuncture, is that not placebo? It's the same with a lot of holistic, the crystal healing, the Reiki, and sometimes you're just like, it just works. You've just got to trust it. Because it works. Like, why question it? Why want but some people, with the scientists, as we know, like some people love the science of it. So now things are starting to align with the age-old treatments plus the Western medicine. And there was one about the placebo effect, but also who is looking after you. And they found that the people who felt more listened to and more understood by their doctor or their nurse or whoever they're dealing with, their healing rate is a lot more successful.
Wow. God.
Yeah.
What an introduction. That's crazy. Oh my God. Okay, so on to the cupping then. What is it?
Right, so cupping, I mean, right, I got my notes because there's a lot of different things, because cupping, the earliest cupping recorded in text was between 200 and 300 AD.
What?
So this was like the horn technique that they spoke about. So they were using animal horns. And you can still find, I was having a little look last night on YouTube, and there's a guy on the street in Vietnam and he's using literally buffalo horns.
Right.
So anything you can create suction with. Bamboo pots. So I borrowed some from the school, and Chris Davis has a set. And I looked at it, and it was actually used as a chopstick stand when I was a kid. So there was actually a bamboo cup in my house, but I wasn't aware of what it was used for. So things that would have been easily, got hold of back in those days: animal horns, bamboo, pottery, fire jar needling. So coming through a few more years, into different dynasties. They then introduced the fire jar, but glass cups and vacuum ones are what you would see more now. These kind of cups that they use now are really good because you've seen them. They get the indentations to hold on to. They're very safe. We'll check them every single time for a client to make sure that they're not chipped or anything like that. But apart from that, they're very, very safe. The vacuum cups as well are used by physios a lot.
Are they?
Yeah, you can see like in different places. They won't be used. So because mine is traditional Chinese medicine, you'll see us use it over meridians more. We'll use it over needles because it helps accelerate all the chi to that area. But the plastic vacuum cups, they're used quite a bit. If you look on YouTube, you'll see an awful lot because they bring so much blood supply to the area. Cupping itself is to pull toxin build-up from deeper levels. So as I mentioned, we can split the conversation now, and we'll talk about like the TCM, but then we'll also talk about later on about it from a musculoskeletal level.
Okay.
So yeah, cupping is all about, again, moving things. It's all about movement. TCM, pretty much, it's all about moving things, because if things are stagnant, then it causes disease. So again, it's another facilitation for movement.
Wow. So would you say then that people who sit a lot, like say if they got a desk job and stuff, they would need cupping more than somebody who's like yourself, who's on their feet all the time working?
I'd say it's good for everybody. The more I've delved into it, like you said, Martina, it's part of the culture. Yeah. I went round to my neighbours, and they're from Poland, and they already knew. I'm ready to explain what cupping is, because in England it's not so. It's more and more since Michael Phelps and he's swimming in the Olympics and everyone can see the marks. Oh. People are more aware of it, but a lot of the time you have to explain, and most of the time the question is, does it hurt? So once somebody's had it, you've had it yourself. Yeah. It's just a tension, and it's such a relief when they come off. Yeah. But I think everybody could deal with it, because yes, I'm on my feet and I'm running around a lot more, but I'm using a lot more energy. If you're more sedentary and you sat down, especially in your lower back area, it causes a lot of stagnation. One of my theories is that, why a lot of people are getting kind of, gynae issues and all lower back pain is because there's no movement in that area. Because we're sat, we're shortening the hip flexors. Like, we're constantly in the same position. We're slumped forward, which is compressing our chest chi, the energy that's in our chest. So, and then, sometimes the only time somebody will pop out is to go and have a fag. Yeah. So there's no fresh air there either. So all of that on top, and and then you sat there and you're snacking. So not only are you not moving physically, the stuff that is happening to your body that helps you with your internal movements, slowing down, bad food, bad air, bad thoughts, all of it creates this stagnation. So I believe everyone could benefit from regular cupping. Definitely.
So, like, the bad thoughts then, what do they create?
Emotional heat. So if you think about heat and how it can dry things up.
Right, yes.
So, I mean, there is now even more studies again of the direct link between mental health and gut. Vice versa, it's like the second central nervous system. It gets, you and probably most of the listeners will know that as soon as you have, an episode where you're really in a prolonged time of stress, how often that goes to your gut. Yeah. So it can be either constipation or diarrhea. Now, heat can either dry up fluids or can speed them up. So if you speed up the fluids, you might find that you're constantly getting diarrhea, which, over a prolonged period of time, is that going to end up like colitis and Crohn's and diverticulitis, those kind of things. Like, if it's drying up the heat and you're not moving, you get the constipation, and then you're getting stagnation in that area. And how is that going to affect everything that sits around it? From a woman's point of view, if you've got stagnation low down in your bowel all the time, what is that doing to the blood flow that is then moving around your reproductive organs? And where does it stop? So when you've got those thoughts and you've constantly got a stressful life and it's creating emotional heat, you'll see it a lot in people. Emotional heat tends to rise.
Yeah.
Red faces. You think about somebody who's angry and they've got a bright red face. You could just see at the tops of your ears. It's a point. We bleed at the top of the apex of the ear, just a small amount, just to let that heat out. But you can see it's rising up, and you can see that then, when you bleed, that it's almost like an instant relief. And it's the same with the needles we've got in our heads at the moment. You can literally feel like the tension dissipate.
I just said that to you. I feel like it's all draining away from me.
We needed it because of the stress of this. We don't want to get constipated. Get some needles in the head.
So would that work then? If somebody was constipated, so you put a needle in their head, would it
sometimes it helps. It depends what the root is, and that is why TCM is so powerful, because you've probably heard from every single person TCM gets to the root.
Yes.
We are about the treatment, the prevention, and the very root, preventing what is inevitably going to happen, because TCM shows the patterns and how they can manifest in people. Some people might have a weaker liver energy, they might have a weaker spleen energy, might have weaker kidneys, or some people have strengths elsewhere. So it's following those patterns and preventing it. So say someone was constipated and they're not moving a lot. So how about we get them moving a bit more? But they might need energy because they might be so fatigued.
Yeah.
So in which case, perfect example, stomach 36 is a point on the leg. So not only are you working with the stomach channel, but you're also tapping into the energy systems of the body. So we can get them moving, which gets the blood flow moving around the organs, gets you physically moving, and who knows, then, poop might happen.
Oh my God, this is, honestly, I say it every podcast, it blows my mind, but it really does.
Yeah.
Because,
it's amazing.
We're not, here in England, born and bred in England, we're not taught this. Mm-hmm. We're just, you get a problem, you go to the doctors, they give you antibiotics or they give you a pill. Yeah. They don't tell you, how to improve your life so this doesn't happen again.
Yeah. Yeah. I mean, don't get me wrong, I treat, people from different backgrounds, and I do have people that come from Western medical backgrounds, to deal with certain different things, and I think Western medicine's fantastic. I really do, and I think the two worlds together would be amazing. So say, for example, somebody has got they're on some medication that Chinese medicine sees causes a lot of heat in the body, so by helping support that system, my kid's dad would not have survived without the intervention of Western medicine.
Really?
But because I felt so helpless, if somebody needs an operation or something, but we can help with the facilitation of the healing process. We can speed it up. We can help support if you're on certain medication. So if the medication has a side effect of affecting your kidneys, for example, we can help support the kidneys. So you've got more chance.
Right. So you'd still keep taking the medicine, but you'd have this extra kind of support to help the kidneys.
Definitely. And I mean, who's to say, we have had people within the school that have got people kidney dialysis. It's so powerful.
Oh,
people have got people walking again. There's so much. But then there is a point where, if we had the two working in harmony, and if we were taught, like you said, from a young age to understand these symptoms in our body from lay terms, rather than it being, you need a Latin dictionary to navigate through, and reels of booklets of your side effects. If we were taught from a young age to do things like meditate, how much emotional heat would we bring down? You can see emotional heat in teenagers with their acne, with their anger, with their lack of being able to regulate themselves. Well, if we just had that little, learning the acupuncture points and the tapping therapy on those, so they're not even having to needle themselves, but imagine how much that would stop certain behaviours that are going to create disease later on in life.
We need to, this needs to become, well, here we are doing the podcast.
I know.
Raising awareness.
I know.
Okay. So back onto the cupping there. So what can it be used for?
See, what can it be used for?
Right.
So this is where I suppose it's going to split a little bit between the eastern and western side of things. So I'll talk, I suppose, about my clinics. That's what I know works. And for me, in my clinic, pretty much everyone gets cupping.
Yeah.
Everyone, because it moves so much and it is so calming and it's so warming. So the fact that if we've got you think like if your nan said to you, you'll get the wind in your neck, you know, to wrap yourself up, or you'll get cold in your bones. So we've always used these kind of terminologies within our culture. Say our culture, me, the British side of me. But actually, then the eastern side of me understands that cold does get into the bones. So it's seen as a bite syndrome. So it can cause things like arthritis. So in which case, to warm you up, and you warm your internal system. So you've got moxibustion, which you probably spoke about or you're going to speak about. That's a really good one to warm up. But cupping itself, because we're using the fire cupping as well, then we're warming up the systems. But using them on the back points in the body, each point on the back relates to an organ. Right. So we've got points called Wattajagi points. And so, like, for example, I think I've needled you in the top part before, lung, pericardium and heart. So I'll use that quite often. But then what do I do if I've got a needle phobe?
Yeah.
So we put the cup over the acupuncture points and it draws the energy, the blood supply, and moves all along those. You've got your inner and outer bladder points and your Wattajagi. So your back is a whole microsystem in itself. So the cupping, you'll see everybody walking out of the clinic with cupping marks, especially on their back. But then when you go to a musculoskeletal side of it, if you are understanding what's going on with the tension within the body, so say, for example, someone's tight on one shoulder, and then they've got a tension in the lower part of the other back. Now, if you put the cups to reduce the tension on the tight side, then you usually find that it releases off that lower part. So it depends which approach you're coming from. So I suppose mine's more systematic. That's where my real passion lies. I like to see what's going on in the internal systems of the body. But when I am treating like sports people, as mentioned earlier, like my background is in fitness as well. So if someone's got a tight bicep on the one side, we're using the cupping, and you can even manipulate them gently and stretch out tendons and ligaments with them. Great for tendon healing as well, because it brings so much blood supply. The sliding cupping, again, you can lengthen things out with that. You can use it on cellulite. So, you know, it's a super duper treatment. One I'd use myself, I'd get my coffee grinds out of my coffee machine and then rub them in the shower. I'd get a gua sha tool. I'd be increasing the blood supply with that. And then you can get the silicone cups for the sliding as well. So it's just really, it breaks things down and it helps to bring the blood supply up and then flush them away. So not only are you just breaking things down, you don't want them sat there causing stagnation, you're then assisting the body with flushing it away.
So to flush it away, is that when like the colours come up?
Yes, yeah. So the colours, as we're speaking about, a lot of people call them bruises, but they're marks. So they're indications your body is talking to you. It's like the difference between the different colours. I mean, we could possibly put a little attachment of a picture to explain, but the darker the marks are, the more stagnation there is. That's a very general rule, because sometimes if you've got white cups, it can be a bone issue and all the rest of it. But the darker the marks, the more stagnation there is. And to actually understand that and see, and then watch them start to heal, and then the next time you come back for your cupping, to see the marks are lighter, you've all of a sudden got this self-belief in your body, and it's healing.
Right. So the darker ones mean stagnation, and the whiter ones mean bone. Is that what you just said?
It can do, yeah. So cupping itself, when it comes to the marks, in our body, cells use oxygen and give off carbon dioxide. So when energy is blocked, this cell waste gets blocked, and that cell waste becomes acid or toxin buildup, and this creates physical pain. So again, this is like, you think about acid and toxin, if you had to put a colour to that, you'd think, oh my God, that's like red, orange, yellow, fire colours. So there you go, there's your heat. So cupping pulls blockages from deep and brings it to the surface where it's easier to sweep away. So you imagine you were brushing your floorboards, you're only getting the top layer. If you get a vacuum and you get deep into the crevices, you're getting the deep stuff up and out.
Yeah.
So it's kind of like that with your body, where the superficial blood supply or the capillary system that sits at the top, your cupping brings that up from deep in bone, ligament, tendon, tissue, even organ level, depending on where you're putting the cups, and it brings it up, and then that encourages red blood cells to repair. So where there's pain, there's stagnation.
Okay.
So we go towards the pain and to help facilitate the healing. So it stretches the tissue, breaks adhesions. So when it comes to using it as a diagnostic tool, where the skin turns red in colour, we tend to say that the problem is blood and tissue. But what we're looking for is whether it's initially or eventually, we want a slight colour change, because there is going to be blood supply there. So that's when you're getting onto maintenance work, where you don't want it to get any worse. You've got a nice healthy part and you want to stay there, so you keep up with your regular treatments or whatever your self-care is. If there's no colour change, we're going to start looking at bone, tendon and ligaments, because they've got such a low blood supply. But if the skin is white or pale, so then it indicates deficiencies. So that could be in blood or it could be in chi, in which case then we'd look towards the organ system, the meridians, and to boost the energy and the chi.
Right. So organs then, they can go without, like they can lose their chi.
Yeah.
So how do they lose it then?
Oh, there's different ways. Chinese medicine will talk about. So to put them into kind of Western terms, overexertion. So if we're burning the candle at both ends, we know we're going to get tired.
Yeah.
So there you go, there's a deficiency. And it depends where you're stealing that energy from. So we talk about constitutions with people as well. So if someone's got a strong constitution, they're able to do a lot more. Whereas if, say for example, diagnostic can start from the moment a client speaks to me on the phone.
Yeah.
If they've got a weak voice, I'm thinking, right, and this isn't judgmental, this is patterns, this is who you are, so don't try and hide it from your therapist.
Yeah.
Don't try and go in there and say, so for starters, your tongue and your pulse will say different. But if you've got someone who can't be asked to speak, can't be bothered to speak, or they're just very we're like, right, okay, what deficiency is going on here? But if you've got someone who's really loud and they're booming voice and they're big energy, okay, we're going to think, well, maybe they've got an excess somewhere. Then when they walk into your clinic, how are they holding themselves? If you see that they're like very tucked up and they're like they're looking down, again, that would indicate possibly deficiency. It could be something, that trauma related.
Yeah.
It could be mental. But again, that mental work that is going on is going to be borrowing from something on a systematic level. And then when it comes to complexion of the face, are they pale? Are they really, really slim? What is going on with them? So then you start to put your diagnostics together, and then you start to look at the tongue, you look at the pulse, you can do abdominal diagnostics as well, and see what's going on. So if say, for example, the pulse was quite weak, again, a deficiency. So with Chinese medicine, you've got different pulse points that relate to different organs. So say, for example, I found a deficiency on the lung point, and that person's tongue said the same, that person's breathing said the same, that it's almost like they haven't got enough energy to put forward their sentences. It could be lung chi.
Right, I see. It's all kind of coming together. But when would you then use cupping over acupuncture or tweener?
Well, TCM in itself. So I went to total therapy just to learn some cupping, and then I realised how much everything just works with each other. So there is a few times where you choose one over the other, but most of the time I would always use a combination of a few. But one, for example, if a client is, so I'm tactile. I'm a tactile person. I love massage. I love touch, but not everybody is the same. So if somebody walked in clinic, they're a needle phobe, they're not a tactile person, they can't stand to be touched, but we've got this presenting musculoskeletal issue. What do?
Yeah.
Cupping. So you're able to build a rapport with that client. You can hand them a cup, they can look at it, we can explain exactly what's going on. You get your client lying face down, again, that's taking the edge off if they're not comfortable, white coat syndrome and all the rest of it. And then the cups are applied to the areas they need without you actually having to keep on massaging or, putting needles in. So that is a very useful tool when it comes to that kind of situation. The cupping, it's hard to think about a time where you'd actually choose it, because it's brother and sister with gua sha.
Oh, is it?
Yeah, it's amazing. Like, gua sha together and cupping are like best friends. Then with the needles, the acupuncture, if you put a cup over an acupuncture point, it's fantastic. Or if you had a really, really tight muscle, you could use your tweener, then maybe acupuncture it just to loosen it up, and then you get your cup on top. You've got 3 layers of treatments there.
Yeah.
So it would be hard, but from my own experience, I'd say that would be one time where you really would use cupping. Or if your client, I get a lot of them now, it's quite popular, they're like, well, what's this cupping stuff? And they really want to have a go at it. You don't really get people coming in, what's this acupuncture stuff? Put some needles in me.
Yeah. Oh my God.
Yeah.
So, like, for you then, because I know I've been on the receiving end of it, you don't, so say for instance if someone said, oh, can I book a cupping session, you kind of be like, well, no, I would diagnose you in that session and use whatever tools would be necessary.
I'd always try and get the client's rapport, because if that's what they wanted, let's do it. Like, the fact that you are curious about something within TCM, let's do that, let's run with it, because it's already shown that they've got this kind of like trust or this curiosity about something. So let's go and do that. But along the way, I mean, you totally end up converting people to everything anyway, because it's very hard not to put across the passion.
Yeah.
From probably everyone you spoke to, once they start to talk about what they're interested in, it's infectious. So, I'll get cups on someone, but they could be there and they could be really stressed, and these general conversations coming out that they're having a really hard time with work. I'm like, do you know what? Acupuncture needles, auricular acupuncture needles, nada, let's do it.
Yeah.
Or let me do 20 in, which is the one at the top of the head that calms the spirit. If that person is happy to have that done, and you can see your practitioner really, really, really knows that this is going to make a big difference, you're going to end up having all of it.
Yeah.
I've even had waxing clients with needles in their head, because, as a beauty therapist, which was where I started when the massage came into it, all of a sudden people will just, the best time ever is when someone's having a full bikini wax. They will open up to you and they'll tell you their life story. So then all of a sudden you're like, do you know what? There's a needle for that. And you end up kind of like layering up. So yeah, the world's your oyster.
Oh my God. It is infectious, like you say.
Yeah.
Like, I never thought that I'd be here interested in this, but it's from your treatments to me that I'm like, wow. Because sometimes I walk away and it's like, like that issue that I've been dealing with, it's just gone. Like, even mentally.
Yeah. It's such an honour for somebody to trust you, though. And like, as a practitioner, like, as you see now, you're stepping into your own world with your clients. You do not want to leave any stone unturned. You want to help people.
Yeah.
And no matter how much you think, oh God, why can't I just have a normal job? Like, you always end up on this path, and this is the one that makes your heart sing.
Exactly.
So when you've got that kind of spirit about you and you really want to change things for people, but also from a personal point of view, you want to explore your expertise, you then have just got this, it's like a superpower. It's like an endless supply of energy, because this knowledge is coming out all the time. sometimes you'll get stuck as a practitioner, but then there's so many other practitioners around you as well that we support each other.
Yeah.
And that in itself, just, it keeps on adding to the energy for the cause. And and then you find that you end up doing all these more weird and wonderful, amazing kind of treatments for people and getting these results. And you get them quicker and quicker. This is like the whole movement of TCM is becoming this, it's always been there, but it's becoming this big evolution because now we are able to measure results with blood pressure machines. You know, I did one treatment before, and it was I've done it a few times actually, the NADA needles with a meditation and doing the blood pressure before and after. You can see it there.
Wow.
The change in it is immediate. And with cupping, you take the cups off, the pressure that's taken off you physically is an immediate release, as well as physically being able to see the cupping marks and being able to explain to the client, you see where you knew that knot was, it's there.
Yeah.
And it's lit up in bright red lights usually.
Yeah. Oh my God. Okay, so what is, like, you kind of touched on it a little bit, but what is the biggest transformation you've seen using cups?
I suppose it's, for me as a practitioner, it's mentally. Like, there's nothing better than seeing a client who's coming and think there's absolutely no hope. Because we do tend to get people at the end of their tether because they've been to this person, that person, and like nothing's worked. Mm. Very rarely do people come to us first. We're not usually the first port of call, unless you've been brought up in a culture where you already understand the importance. So to just see that someone takes that time for that self-care, and then how that has a knock-on effect in their life. The way they walk, the way they talk, the fact that they're not in pain anymore and they come back bouncing in and they're like, I slept for the first time. It might not been all night, but rather than waking up 6 times that night, they only woke up 2 and they were able to fall back to sleep. That in itself is just, it has this snowball effect then. So there's no real one case of anything that I can think of. It's just that, oh my God, like, this stuff is powerful and people are feeling the benefits of it. And then for your clients to end up becoming practitioners, you're like, yes, this is it. It's amazing.
Yeah. I think there's so much more to be said because, you know, I deal with talking therapies as well. Mm-hmm. And sometimes I'm sitting there and I just think, I just want to give you this extra little boost, you know.
Yeah.
And this is what my idea is for my coaching business, you know, is to bring these therapies in because it just gives them that extra little bit. And also, it's kind of, in a way, they haven't had to do it. You've facilitated it. You've helped it along.
Yeah.
So it makes life easier.
Because it's never us.
No.
It's you that changes things for you.
Yes.
And this is the thing, when you see a client come into your clinic and they're like, even if they're at the end of their tether, but they're just like, I am just searching for something. And then boom, you just suggest something to them from your own knowledge, your own repertoire, and then all of a sudden they're like, that's what I've been looking for. So it isn't us. That's one thing that, like, is a bit of a bugbear with what we do.
Yeah.
We're not doing that. Like, everyone has got their own power within their own body to do it, and that's why I love TCM, because you use your needles on your meridians, and all of a sudden that person is able to fire up their own body. It's like little jump leads for the soul, you know. And if there's, going back to the biggest transformation sometimes, because like mental health itself, because of our histories of, you know, our personal journeys, which a lot of therapists start because of their own trauma. You know, for example, mine was anxiety. Anxiety compresses your chest. You can't breathe. It's horrendous, and it changes the way that you present yourself, and your body becomes tight. So then all of a sudden, if you've loosened it up through tweener, through cupping, your needle points that you can use to unbind your chest to help you breathe better. And all of a sudden that person is walking around with more confidence, and they walk into a job because they've presented themselves with confidence in it. This is how far it reaches.
Yeah.
It doesn't stop. And to just see it just lights up everybody's world, doesn't it?
It's amazing. It is. It blows my mind.
Yeah.
Okay, and lastly then, Tam, because this has been amazing speaking to you, but what's next? Because I know that you're going to be starting teaching cooking, aren't you? But where are you going next?
Wow, what I've learned is do not. My dad said to me when I went to go, because I was doing biomedical science access course to become a dietitian. I had 2 young babies. Their dad was really poorly, and I was just like, this is not the time in life to be able to do it.
Mm.
So years ago, my dad had said to me, why don't you go and do beauty? I was like, Dad, I'm not doing beauty. I ended up going to beauty college. I ended up being a beauty school dropout, and then ended up doing different courses, put myself through courses, because the college was great, but they were very young in the course, whereas I was facing life as pretty much like a single mom, like having to run everything. I needed to go faster.
Yeah.
So beauty college it was. And from there, I've ended up doing what I'm doing. Like you said, I'm going to teaching. Well, me and my friend, we've started teaching already. So I can't say what's next.
No.
But I can't imagine a life without PCM and massage and cupping and gua sha and nada and battlefield and the whole acupuncture, the whole Chinese medicine tribe and everything they stand for. So I don't know what it looks like.
Wow, exciting.
Yeah.
Scary and exciting.
Yeah, very much so. But I do feel like the whole lot, we've all got that support network within us. And even a big thank you to my clients, every single one of them that passed through my door. I was very lacking in confidence when I was younger. I had my anxiety. I would not have been able to even imagine myself as I am now. So again, that's why I can't plan, because I can't imagine if this carries on, like where I will end up. And each one of my clients has helped me with my self-worth. So as much as they're getting something, it's this healthy exchange.
Yeah.
And that's what life's about as well. It's the same with your body, bringing it back into balance, your yin and your yang. You need a healthy exchange. If you're going to keep training in the gym and keep borrowing energy, you need to be putting some love back into your body. So go and find a Chinese medicine practitioner and just give yourself a little bit of love. Yeah. And then you'll see your PBs, and then you will then be tapping into your potential, whatever that looks like. So for me, I'll just keep tapping into my potential, and luckily I've got friends like you to hold me to account. The wonderful Jen Ball to kick my backside into shape. All of my mates, all of my clients, all of my support, all of my mentors. I mean, all of us help each other. So who knows what the future's going to look like? Me and you, maybe. What are we going to be sitting talking about in 10, 15 years? The world is going to give us the challenges. So yeah, I'm really, really looking forward to teaching for total therapy. Again, they're really, really supportive, and they're like, well, what do you want to do? Let's help you facilitate it. So yeah, we're just going to keep exploring.
It's amazing. It's like you said earlier on about Andy contacted the gym and then you met Michelle and everything. It's like they're a magnet that bounce around, and they just attract all these people. Yeah. And then it just turns into this. It just grows again.
Yeah.
But it's not all about total therapy growing. It's about helping the general public.
Yeah.
And then they learn about it, and then that grows. And this is what I think life should be about. We should all just be helping each other to grow and to learn.
Yeah. Absolutely, everyone's got some wisdom that you need.
Yeah.
Like, you just can't judge, can you?
No.
That's a personal thing, off track, but like if there's somebody that maybe the human side of me makes a judgment on, I want to approach them because I want to challenge what's going on in myself.
Yeah.
And why am I drawn to that person?
Yeah.
And I'm always surprised. Yeah. Every single time they've got an amazing story to tell you.
Exactly. And it's like what we learned on ET just recently. Judgment is just a lack of understanding. So I find myself seeking to understand people a bit more. Why do you do that? I'm not judging you. I just want to ask the question, like, what is this about?
That's a blockage. That's a stagnation. Society needs a big cup on it, don't it?
Yeah.
Just get us moving.
like that dome on The Simpsons.
Just get us moving. Come on. But yeah, we don't want to be stagnant with anything. So when it comes down to the cupping, that helps our body, but it's also going to help our mind, and it's going to help broaden our mind and our understanding of our own selves. and also, it's a curiosity, because holistic therapies and TCM and those kind of like things that are off Western medicine, they all of a sudden make you realise that there's actually this bigger world within another world, and all of a sudden all these doors start flying open and you're like, wow. When I thought I was just sat there stagnant in my own little dirty rock pool, and then all of a sudden, you know what, all it takes is for you to make that decision to just go, I'm a bit uncomfortable here, let's get up, let's move. And whatever that looks like, there's always going to be someone there to facilitate it.
Oh, amazing, Tam. Well, thank you so much for your time today. That was incredible. Face to face.
So weird, face to face. Like I just got stage fright at the beginning.
I think we both did. But take care, Tam, and hopefully we'll see you back again, because your journey's never ending.
Thank you very much.
Thank you. Bye.